Now let's start with this fundamental question. What exactly is artificial intelligence and how should we think about it in relation to healthcare? Now, at its core, artificial intelligence refers to a system that mimics human intelligence through learning, reasoning, and problem solving capabilities. But that definition, while technically accurate, doesn't really help us understand what AI means in practical healthcare terms. You want to think about AI as a digital resident or a junior doctor if you are in the US. Now, just as a doctor observes patterns and symptoms, laboratory results, imaging studies, patient history to make clinical decisions and recommendations, the AI system also observes patterns in data to simulate basically a similar decision-making process. Now, this is an essential distinction to understand. AI truly does not understand. Let me repeat that. AI truly does not understand medicine in a way that a human physician does. Instead, it simulates understanding through pattern recognition and statistical analysis. And we will go over some of that statistical analysis in the coming videos. And you can develop an incredibly sophisticated pattern matching, but it is still pattern matching. It is not aware. It is still pattern matching. It is not AGI, okay? It is not aware right now. So the strong word you need to know is that it mimics human intelligence. It does not act like it is intelligent. It's not actually intelligent. And it can have clinical reasoning, pattern recognition, and decision-making even under uncertainty. It can actually give you an answer. Hey, it may not be 100% correct. Now, it acts like a digital resident, observing the same symptoms and patterns. And the key difference is that it does not truly understand medicine. It simulates understanding through patterns. And this is why I emphasize that AI augments rather than replacing human clinical judgment. And the most effective AI healthcare implementation actually combines pattern recognition capabilities of artificial intelligence with the contextual understanding and the empathic nature of human healthcare professionals. And now that we understand what AI is conceptually, let's explore the two fundamental approaches to artificial intelligence in healthcare. One is rule-based AI, and then learning, machine-based learning AI. Understanding this distinction is critical because it affects everything from implementation complexity to clinical outcomes to ongoing maintenance requirements, which all you will be a part of. Now, if we go to first, rule-based AI, and rule-based operates on an if-then logic. If this is true, then do this. So it's a logic that is programmed by human experts, but it is fairly basic. These systems follow explicit instructions that have been coded into the software. A classic example is a sepsis alert system. Now, the first I was exposed to a sepsis alert system was way back about 12 years ago when I was starting my residency. Now, this is that old. So we have come a long way, and we have already improved upon this to make it a much more robust system than we had at least 10, 15 years ago. Now, the system might be programmed to say that sepsis alert triggers when the blood pressure is less than 90. Now, this is, of course, simple to implement and easy to understand. Okay, the blood pressure went down, went below 90 millimeters of mercury. Now, this is very transparent, but the problem is it is limited. And it is really not complex and limited by the complexity of the rules. And as we know in medicine, medicine is fairly complex. Now, there are limitations because they cannot adapt to new situations that were not explicitly programmed, and they may generate false alarms in situations that don't fit predetermined patterns. So, for example, a patient whose blood pressure normally runs 90, this may not be a useful system. This may not be a useful AI. On the other hand, now we're going towards learning-based AI and more machine learning-based AI. The learning-based AI, on the other hand, represents a fundamental approach differentiation. These systems learn patterns. This is going to happen. Now, this is going to happen instead of just simply data. Instead of programming every single scenario, they actually learn patterns from the data. And we train these systems on large data sets that allow them to discover patterns that may not be obvious to human observers. Now, one example is predicting readmissions from electronic health record data, predicting readmissions. It discovers patterns in the data, adapts to new information. So this is the importance of having learning-based systems. And we will actually develop some of them later down in the program. Now, these learning-based systems for predicting hospital readmission might analyze thousands of variables from electronic health records, including not just clinical data, but also social determinants of health, medication adherence patterns, and even environmental factors, whether it is raining outside, it's snowing outside, it's a holiday, it's Thanksgiving dinner, it's Christmas, whatever. The system learns which combination of factors are more predictive of readmission risk. And what you can do, or if you are an administrator, you can see, okay, we are seeing these spikes happening because of these reasons, and it's going to repeat itself the next year. So they can plan accordingly regarding the resources, how many doctors they need, how many nurses do they need, more respiratory therapists for for a particular reason. So all of this is much more valuable than just the rule-based AI system that we had previously. Now, the problem is that it can be a black box, and a black box in this situation is not a black box. For example, when a plane crashes and you're looking for the black box and with all the audio information, everything else. So in healthcare terms and in machine learning terms, a black box is that you are unable to clearly describe why it came to a certain conclusion. And that is fairly important in healthcare. So black box means that the decision-making process isn't always transparent and easily explainable. And this can be problematic in healthcare settings where clinicians actually need to understand why a system made a particular recommendations. And we'll dive much more deeper into these details. But in all honesty, both of these systems, the rule-based as well as the learning-based AI models, have their importance in healthcare, and the most effective AI implementations actually combine both of these approaches. Now, let me explain the rule-based AI a little further, and let me give you just a diagram over here. So the patient's vitals input signals, this is what you're capturing. Blood pressure is checked. Your blood pressure is less than 90. Yes, if it's less than 90. So you get a sepsis alert. The nurse is alerted. And this is the sepsis model. This is the model that's fairly straightforward and simple. It basically means that the logic is hard-coded. Simple if-then rules, they trigger alerts based on predefined thresholds. And benefits, again, is simple to implement, transparent decision-making, and predictable. You know what's going to happen exactly. The limitation is that it cannot adapt to patient-specific contexts, such as I mentioned, chronically low blood pressure, let's say in the elderly or people with end-stage renal disease. Their blood pressure could be low chronically. Another example could be that a young athlete might have a resting heart rate of, let's say, 45 beats per minute, which could trigger alerts for low heart rates or bradycardia alerts, even though that is completely normal for this individual who is an excellent cardiovascular condition. Now, this rule-based system doesn't understand context or individual patient baselines. So this is the problem over here.